This is part 3 of topic 9, slides 40 through 62. And so innervation to the head is conveyed via the sensory information they had, that is touch as well as pain, involves trigeminal nerve, cranial nerve number 5. And so it's going to supply sensations, somatic sensations of the face, as well as innervations to the mouth area, the outer 2/3 of the tongue, and most importantly, for an exam, the dura mater covering the brain. Skin around the ears, nasal area are going to be conveyed via the facial nerve number 7. The pharynx is going to be cranial nerve number 9, glossopharyngeal, as well as the vagus, cranial nerve number 10. And so the 3 branches coming off the trigeminal that's going to do the convey the somatic sensory is the ophthalmic, or V1, maxillary, and mandibular. And so this just shows the area in which these branches are conveying somatosensory information. And so the sensory pathway for the head and face is sensations from, for example, for the face, head, forehead, anterior part of the scalp, stuff like that. The nerve branches that are doing this are, again, the maxillary, ophthalmic, and mandibular. They're going to be your first order neurons. And so the ganglia that conveys this is your trigeminal ganglia, and where they're going to project is they're going to project to 2 areas, either the chief sensory or spinal nucleus. The chief sensory or spinal nucleus is your second order neuron. And so in terms of the modality that the chief sensory nucleus is going to do, it's going to be discriminative touch. And the trigeminal spinal tract was they're going to project to the thalamus. The thalamus is going to be your third order neuron. Now, unlike what we talked about earlier in terms of the thalamic nucleus being the ventroposterior lateral thalamic nucleus, in the case of the trigeminal, second order neuron coming from the chief sensory nucleus in or the trigeminal spinal tract, they're going to project to the ventroposterior medial thalamic nucleus. And then this is going to project to the lower third of the postcentral gyrus, the more lateral aspect of the postcentral gyrus in the parietal lobe. And so here it just shows a diagram of your different branches that are coming off the trigeminal. Here's your first order neuron here, synapse on either your chief or spinal trigeminal nucleus. This will cross over, and then, and this will ascend into the ventroposterior thalamic nucleus, and then from there, it's going to project into the cerebral cortex, into the parietal lobe. And so here, what you're looking at is you're just looking at, again, these 3 branches that are coming in, synapsing either on the chief sensory neuron, or you get projections that are coming in, synapsing onto the nucleus of your spinal tract of your trigeminal nerve. Falling synapses either on the chief sensory nucleus or synapsing onto your spinal tract of your trigeminal nerve, your nucleus of the spinal tract of the trigeminal nerve. They're going to give rise to your ventral secondary ascending tract of cranial nerve number 5, or that's abbreviated as VSA of tract 5. And there they ascend, making a synapse into the ventroposterior medial thalamic nucleus, and then that's relayed over to the parietal cortex, into the medial area of the lateral area of the parietal cortex. And so unconscious proprioception, we're moving on to another track This is proprioception projections to the cerebellum. Uh, Most are IPSI to input. There are some that are going to be contra. The receptors are going to be your muscle spindle and Golgi tendon organs. These are originating from nerves endings in limb joints. And so your neural pathways for this pathway are going to be your ventral spinal cerebellar tract. That's also referred to as your posterior spinal cerebellar tract. I mean, that's referred to as your anterior, excuse me, let me correct that. That's referred to as your anterior spinal cerebellar tract. This is a tract that's going to cross over. And so it's going to cross over. And this is the tract that's going to have that weird projection. It's going to go from ascending in the contralateral side of the spinal cord, and it's going to enter into the cerebellum via the superior cerebellar peduncle, and then once it gets inside the cerebellum, it's going to cross over to the ipsilateral side. Now, the dorsal spinal cerebellar tract, also referred to as your posterior spinal cerebellar tract, this is going to ascend ipsi, and it's going to enter the spinal cord via the inferior cerebellar peduncle. And this is going to convey proprioceptive information from the lower extremity. Same thing with the ventral spinal cerebellar tract, or also referred to as the anterior spinal cerebellar tract. Now, your craniocerebellar tract, this is going to be analogous to your ventral and dorsal spinal cerebellar tract. This is conveying proprioceptive information from the upper limbs and neck. Okay, and so that information is being relayed, and it's going to synapse onto, remember, the lateral cuneate nucleus. And then that's going to give rise to the craniocerebellar tract, which is then going to project into the ipsilateral cerebellum and into the vermis via the inferior cerebellar peduncle. Okay. And so here, this slide just talks about the different types of clinical correlates and assessments. And so, again, just looking at spinal cerebellar tract, which is unconscious proprioceptive information. Here, coming from the Golgi tendon organ, for example, the one that's going ipsi, that would be your posterior spinal cerebellar tract. It's going to, again, the posterior spinal cerebellar tract, let's go back up just a second. That is the same thing as your dorsal spinal cerebellar tract. Okay, this is going to enter into the cerebellum, eventually into the vermis, via the inferior cerebellar peduncle. And so your spinal cerebellar tract, lower spinal cerebellar tract, posterior and anterior. Again, remember, anterior is going to cross to the contralateral side, ascend, enter into the cerebellum via your superior cerebellar peduncle, and then it's going to cross back into the ipsilateral side. Okay, in terms of temperature, this is your temperature pathways. The receptors are going to be running with your A delta and your unmyelinated C fibers. They're identical in terms of their pathways to your pain pathways. These thermoreceptors are going to respond to different temperatures. For example, cold receptors will increase their firing rate when body temperature gets below 30 degrees Celsius. There are more cold receptors than there are warm receptors, 5 to 10 times more. Your warm receptors will respond to temperatures that are greater than 30 degrees Celsius. And so here it just shows body temperature here. As one decreases their body temperature from 38 to 32, you get an increased firing rate of your cold receptors. As the body temperature begins to rise from 32 to 38, you get an increased firing rate of your warm receptors. And lastly, This is just showing the different tracts that we talked about, sort of ascending tracts. Your dorsal column, your fasciculus gracilis and cuneatus. Your posterior spinal cerebellar tract, remember that's an ipsilateral projection. Your anterior spinal cerebellar tract, remember that's a contralateral projection. Your lateral spinal thalamic tract, that again is a contralateral projection right here. We didn't talk anything about your spinal tectal and didn't really talk much about anterior spinal thalamic tract other than the modalities that it has and things like that. And so I'm not going to hold you responsible for the spinal tectal. Okay? And with that, I'm going to conclude topics 9.